this pandemic, one of the greatest tragedies has been the deadly nature of COVID-19 for our seniors living in long-term care. Not even our most strict policies of infection control and visitation protocols have been able to fully protect our elderly Oregonians living in these facilities. It feels really good that we are now able to start these vaccinations with the hope that these folks can reunite with their families once again and feel safe from the virus soon. Nearly 4,500 frontline healthcare workers in Oregon have received vaccine doses so far. Step by step, we are making great progress fighting this virus. I say that because in addition to rolling out this much-awaited vaccine campaign, there's evidence that our 2-week freeze and the safety measures we have taken since then blunted the virus surge we were all dreading as we entered the Thanksgiving holiday. Thanks to Oregonians respecting our safety measures and making changes to their holiday plans, we didn't see the spike in cases we feared, and as we saw following previous holidays. I hope you all heard that. Thanks to the decisions you and the majority of Oregonians continue to make, we are slowing the spread of this disease. And while our case counts are still up, we are avoiding many worst-case scenarios. I'm extremely proud of us, and I hope you are too. This is proof that we determine how the next few months play out while we work to swiftly distribute the COVID vaccine far and wide across the state. So, as we did with Thanksgiving, I ask you to once again rethink your Christmas and New Year's plans. Dan and I are going to miss skating in Minnesota with my family this year, but look forward to a day filled with phone calls and Zoom calls with our loved ones. And of course, no New Year's Eve party this year. In more good news, by now, we have all seen that Congress passed a $900 billion stimulus package. I appreciate the Oregon congressional delegation's hard work in getting this package over the finish line to deliver much needed resources to Oregon families and to our businesses. This is in addition to the $800 million package the legislature set aside during yesterday's special session. I called for a special session because it's absolutely critical we get the help to Oregonians who have made the necessary sacrifices to prevent the spread of COVID-19. I am incredibly grateful to the Oregon legislature for coming together to pass policy bills that will provide relief for our tenants and landlords, will keep roofs over people's heads by extending the eviction moratorium, and support for our restaurants and bars. I'm also grateful to the bipartisan work of lawmakers to deliver on a wildfire relief package. As governor, one of the most difficult parts of the pandemic is the decision to close down our businesses and parts of our society when we have a surge in cases. It can be very difficult for Oregonians and also very necessary. But I know that even when needed to save lives, these measures take a toll on so many who are trying to provide for their families or keep a safe, warm place to call home. Both the $800 million in relief from our state legislature and the long-awaited stimulus package from Congress will be an enormous lifeline for Oregonians who have suffered so much. It will help carry us through the coming months as we continue to gain traction with our vaccine campaign. Last week, we vaccinated our first healthcare workers, and I think for that very moment, we all glimpsed that the light is at the end of this very long tunnel. As we continue to work our way through vaccinating our healthcare workers, as well as our residents and staff in long-term care facilities, we look next to the groups identified by the Advisory Committee on Immunization Practices and recommended to the CDC including people over 75 and workers who are critical to keeping society going. One of the things I know for sure is that our educators, school staff, child care providers, and early learning educators must be at the top of the list in Oregon's next round of vaccines. Our kids need to know they're number one, and that we're doing everything we can to get them back into our classrooms. This pandemic has shown us the hard truth that in-person instruction is so much more than what we take for its face value. School is where our kids connect with their community. It's where many kids get meals and much needed support from caring adults. It's a place of comfort, of learning, and of growth. Educators and school staff are without a doubt essential to Oregon, and getting our kids back into the classroom is crucial to all of our success. As we continue to work towards stemming the spread of COVID-19 in our communities, getting our teachers and school staff vaccinated will help ensure we are making learning environments as safe as possible. I will end once again by saying thank you. I know the mere thought of 2020 coming to an end brings a smile to many of our faces. It certainly has been a year for the books. Even in our most difficult moments, I continue to be endlessly impressed with how Oregonians come together and lift one another up during tough times. You all remind me of how special our state really is. Please stay safe over the holidays and as we ring in the new year. And with that, I'm going to turn it over to Director Allen.
Thank you, Governor. I want to provide an update today on the first week of Oregon's COVID-19 vaccination effort and talk to you about where we stand in the course of the pandemic. Across Oregon, vaccination against the COVID-19 virus is ramping up. Healthcare workers, vulnerable residents of skilled nursing facilities, and the staff who care for them are all being vaccinated. By the end of last week, Oregon received the full 35,100 doses of the Pfizer-BioNTech vaccine promised by the federal government. We distributed the vaccine to 16 hospitals across the state. Those hospitals all administered first doses to members of their staff who come into contact with patients and could be exposed to the virus, from nurses who provide intensive care to laundry and environmental staff who ensure that patients have clean and comfortable rooms and bedding. These vaccinations represented the first pivotal steps toward building a critical mass of state residents who are immunized against the virus, which is how we are finally going to stop its spread. I want to take a moment to thank our hospital partners for the hard work they're doing to launch this historic mass vaccination effort. As I said last week, the race to the starting line is over. How quickly we start the race isn't important, it's how quickly we end it. Administering a vaccine across hospital systems that are already being pushed to their limits by a pandemic requires careful planning to minimize any disruptions that could interfere with patient care. I appreciate the careful and urgent steps our hospitals are taking to administer vaccines to their staff as quickly, efficiently, and effectively as possible. Most of all, I'm grateful to the healthcare workers who have been heroes throughout this pandemic. It's fitting, truly, that they are the ones, by being among the first to be vaccinated, who will light the path for all of us to follow out of this dark, terrible forest that is the coronavirus pandemic. Last week, Oregon received its full allocation of 35,100 doses of the Pfizer-BioNTech vaccines. 24,375 were distributed to hospitals and 10,725 were distributed to long-term care facilities. Through yesterday, with brand new information I've just received, 4,475 people were vaccinated in our state. In the first week, those numbers included one person in the 16 to 19 age range and 30 people over 70 years old. Jackson County had the highest rate of vaccinations at 25 per 100,000. We've committed to being as transparent as possible about Oregon's COVID-19 information. You can follow our progress on a daily basis by going to covidvaccine.oregon.gov and looking at our daily dashboards. The weekend marked another historic development in our fight against the virus. The Moderna vaccine received emergency use authorization from the federal government, followed quickly by review and approval from the Western States Review Panel. We now have a second vaccine that rigorous, large-scale clinical trials have found to be safe and effective against COVID-19. The Moderna vaccine clinical trials involved more than 30,000 people from all backgrounds. Nearly 4 in 10 participants were people of color. The vaccine was tested at 100 sites around the United States, including Oregon. The vaccine was well tolerated. No serious health concerns were attributed to the vaccine among participants. The vaccine was found to be 94.5% effective in preventing COVID-19 infection. Because the Moderna vaccine does not need to be stored at the same extremely cold temperatures as the Pfizer vaccine, it gives us the welcome advantages of more quantities of vaccines to provide to hospitals with more flexibility in how we distribute them. We'll use the Moderna vaccines to reach hospitals and clinics that don't have easy access to the ultra-cold storage facilities that the Pfizer vaccine requires, including more rural healthcare settings. Yesterday, 12,100 doses of the Moderna vaccine arrived in Oregon, and hospitals began administering it to their staff. Here's a breakdown of yesterday's totals. This is actually the brand new information I just received today. 165 healthcare workers received first doses of the Moderna vaccine. 2,408 people received Pfizer vaccines. By the end of yesterday, 7,203 Oregonians have received first doses of a COVID-19 vaccine. This week, Oregon expects to be allocated 25,350 doses of the Pfizer vaccine. 19,500 doses will be distributed to nearly 20 hospitals, and 5,850 will be distributed to skilled nursing facilities. We also expect to receive 72,100 doses of the Moderna vaccine. All 72,100 will be distributed to more than 40 hospitals and other healthcare clinics around the state. Next week, Oregon expects to be allocated 32,175 doses of the Pfizer vaccine. 26,325 doses will be distributed to hospitals, and 5,850 will be distributed to skilled nursing facilities. We also expect to receive 25,000 doses of the Moderna vaccine, and all 25,000 of those doses will be distributed to hospitals around the state. In total, by the end of this month, Oregon expects to receive a total of 92,625 doses of the Pfizer vaccine, 97,100 doses of the Moderna vaccine. At this pace, we continue to remain hopeful our hospitals and other partners can administer first doses to approximately 100,000 people in Oregon. A couple of points I do want to clarify. First, when we talk about distributing the vaccines to hospitals, that includes tribal health authorities. Tribes have been hard hit by the pandemic, and we're committed to supporting our partners in sovereign tribal nations. Second, it's really important for all of us to remember that Oregon's allocations are likely to change because our allocations are determined by the federal government. In case anyone has any doubts, Oregon wants as much vaccine as possible as soon as we can get it. We believe every adult Oregonian should be immunized against this serious and potentially deadly virus. Our goal is to vaccinate a critical mass of Oregonians to stop the virus from spreading and wrecking more lives. But we depend on our federal partners for our vaccine supplies. We are in constant communication with CDC, and we receive frequent updates about our vaccine allocations. However, while those updates are frequent, they can also be surprising. This week, we learned our Pfizer vaccine allocation would again be cut, this time by over 30%, and our Moderna allocation will be reduced by 7,000 doses. We all need to understand and prepare for the fact that vaccine distribution will be a fluid and changing process as we go forward. While Oregon's vaccine allocation changes, it does not mean the state has not requested enough doses or that we failed to plan appropriately. It means that our federal partners have changed our allocation, either due to their own decisions or as a result of global or national supply constraints. That means we have to be prepared for months of limited supplies and the need to prioritize who gets the vaccine and when. But as more vaccines receive emergency use authorization, we hope supply limitations will begin to ease up. Now, as the vaccines begin to become more widely distributed, let's take a look at where Oregon stands in the course of this pandemic. Yesterday, Oregon reported 846 new cases for a total of 103,755 COVID-19 infections. Sadly, we also reported 6 new deaths, bringing our death toll to 1,347. As we've said so many times before, every death is not only tragic, it's preventable. Now more than ever, as we begin to roll out a vaccine. At the same time, I can't express how proud I am of the people of the state. As the pandemic rages across the world and across the nation, Oregonians have demonstrated that it's possible for people to adapt and to make small but significant changes, like wearing a mask or limiting your social gatherings, to save someone else's life. Yes, there are people who haven't listened, but the vast majority of Oregonians have, and you've made a difference. You've literally saved the lives of thousands of people in your community, across your state, and who knows, maybe even in your own family. And it continues to work. In Oregon, COVID-19 cases dropped 11% last week. Oregonians prevented the post-Thanksgiving surge that could have overtopped our hospital. Our state ranks 48th in the nation in COVID-19 case rates over the past week. Yesterday was the darkest day of the year, as measured by the amount of daylight. The vaccines promise brighter times ahead. But while we've been grappling with the pandemic for 10 months, we face at least as many more months before we reach that critical mass of vaccinated Oregonians that will stop the virus in its tracks. As grateful as I am for the responsible actions of so many Oregonians, we need to maintain the adaptations we've made, the habits we've learned, for a few months longer. Keep that mask in reach by the door. Keep your in-person get-togethers small and infrequent. Avoid indoor crowded places. I know it's hard as we approach Christmas and New Year's, but in a time of pandemic, we've all learned how a joyous gathering can have life-altering consequences. Don't let the memories of this holiday turn into painful regrets because of a careless gathering led to a tragic outbreak. We can enjoy each other's company without being in each other's presence. We can celebrate the season together from different locations. We can show we care for each other by keeping each other safe and healthy. Thank you again for all you are doing to stop the virus from spreading. Now let me turn it back over to Governor Brown.
Thank you, Director Allen. I think we're ready for questions. And so Charles, back to you.
Thanks, Governor. For the reporters on the line, just a quick reminder, please press the raise your hand button under the participants tab to ask a question. We'll start with Lauren Dake from OBP. Go ahead, Lauren.
Hi, Governor. Thanks for taking these questions. I'm sure, as you know, there was a lot of violence outside the Capitol yesterday, some property damage to the building. Several reporters were assaulted. I'm just wondering if you could address the violence and also mention whether you think it's time to consider that there's more security added to the Oregon State Capitol. Thank you.
Thank you, Lauren, and let me be perfectly clear. I absolutely support the rights of Oregonians to protest peacefully. Doesn't matter what issue that they care about. But the violence yesterday at the Capitol is absolutely unacceptable, and it solves nothing, it answers nothing, it resolves nothing. And I think we're all a bit horrified that in our at the place of our state government, our state capital, that it actually occurred yesterday. In terms of security protocol for the state capitol, it is run by the state legislature. The presiding officers make the decisions about security requirements, and so that's literally in the hands of the legislature. But I think I want to make sure that all public policy makers feel safe when making difficult decisions, whether it's funding decisions to make sure that Oregonians have the resources needed to stay in their rental home, or making sure that the Oregon Health Authority has resources to address the pandemic, or making really tough public policy decisions.
Thanks, Lauren. The next question will be from Liz Birch with COIN. Go ahead, Liz.
Hi, Governor. I have two questions. The first is if there's any indication which essential workers will be included in the 1B phase of the rollout. I know you mentioned teachers. I don't know if there's any other kind of prioritization that's been discussed. My second question is how this reduction in vaccine allocation for Oregon is impacting the rollout. Is it going to be a slower rollout? Is it going to be longer before we see essential workers vaccinated?
Thank you. I'm going to turn your question about critical workers over to Director Rachel Banks. She's Director of Public Health for the Oregon Health Authority. And then I suspect Director Allen will want to step in to answer your question about specific vaccination numbers.
Thank you, Governor Brown. Thank you for the question, Liz. So what we anticipate is that the Vaccine Advisory Committee will be making decisions on 1B and who those critical workers are. As the governor discussed, we see critical workers being education and early learning workers as well. And so we will be working with the Vaccine Advisory Committee to make those decisions. Their process will begin in working together to have a set of principles. And just a little more about that Vaccine Advisory Committee, we received over 650 applications from a wide variety of sectors and people. And we are in the process of selecting the committee to ensure that we have representation of those communities who've been most impacted by COVID-19 and also those workforces and health sector partners as well. Thank you.
Your second question was whether receiving less vaccine will mean that it'll take us more time to vaccinate people, and the answer is yeah. And this is why we've been reluctant to try to project a timeline or anything like that, because we've been afraid of this very circumstance where the amount of vaccine that we receive is different than what we've been led to expect. And this has been a challenge throughout the pandemic, whether it's been personal protective equipment, testing supplies. The federal government has tended to be optimistic with its projections, and then reality tends to be a little bit different. As I said in my comments, one of the keys to this hopefully will be the ability to approve yet more vaccines, so that there are multiple supply channels that can be relied on. But until we get a reliable supply and are able to count on that week in and week out, these disruptions will have an effect for sure.
Thank you, Liz. Just a reminder for the reporters, please just use the raise your hand button if you have a question. We'll go next to Morgan Romero with KGW. Go ahead, Morgan.
Hi there. Hey, you guys kind of just touched on it, but in a different sector of phase 1B, we're talking people that are older than 75 years old. Folks right now in long-term care facilities are getting vaccinated, as well as staff, but we're hearing a lot from the elderly community, in Oregon, wondering when they could get vaccinated. I know you just said reluctant to give a timeline given supply shortages and constraints from the federal government, but I think that there's a lot of concern that if they don't live in an assisted living facility, it could be months and they're lumped in with the general population. So I guess when do you foresee that happening?
Thank you. Director Banks, Director Allen.
Let me go ahead and take a crack at that. The reason that we've prioritized long-term care, skilled nursing facilities, other congregate living facilities is because that congregate care makes them much more susceptible to contracting the virus, and in those settings they're often more medically fragile, and so the fatality rate in those settings, it tends to be very high. You saw the information that the governor presented about ACIP making a decision about people 75 and older. The advisory committee that Director Banks talked about will be tackling those issues of who goes when exactly in 1B. But yeah, this may be a while. I would not say that people who are over 75 are lumped into the general population. I think we do have a priority for the elderly and for people with underlying medical conditions. But until we have some kind of a reliable supply that we can predict week in and week out, it is going to be impossible for us to say, is that going to be 2 months from now or is it going to be 6 months from now? And I know that doesn't satisfy anybody, but that's the reality of where these numbers sit right now.
And Morgan, that's why it's so incredibly important. Oregonians have done, frankly, an extraordinary job complying with a safety protocol, from wearing masks to keeping social gatherings extremely small, to watching physical distance, to washing hands and getting flu shots. We have so many vulnerable Oregonians, either due to age or underlying health conditions. It's so incredibly important through the next few weeks, through the next few months, that Oregonians continue to comply with these safety measures in order to protect, frankly, yourself, your family members, and your vulnerable community members.
Thank you.
Thank you, Morgan. We'll go next to Peter Wong with the Portland Tribune. Go ahead, Peter.
All right. Governor, two related questions. Obviously, the federal aid and the state aid in the emergency fund are relatively new, and I know you're still trying to sort that out. But is there enough money in the till to carry out the initial phases of vaccination and other public health measures?
Thank you, Peter. Thank you, Peter. Obviously, we don't know the nitty-gritty details of the federal package yet. Again, I'm incredibly grateful for our federal congressional delegation for their heroic efforts in getting this package across the finish line. Most of us at the state level have been waiting weeks, months for Congress to get their act together and make this happen. So we're really pleased that it was able to get accomplished. In terms of the details, obviously, I know that there are resources for pandemic response and vaccination support efforts that will be welcome. The package for the state legislature was developed in such a way that we wanted to ensure that the Oregon Health Authority and other agencies on the front lines of the pandemic response had the resources and tools that they needed. I am hoping that the federal resources, frankly, will backfill and that we can turn those resources to helping vulnerable Oregonians and our businesses that are struggling. So we'll be working out the details over the next couple of weeks, and incredibly grateful for the federal effort, and frankly, incredibly pleased that the Oregon legislature, Republicans, Democrats, were able to come together regarding this bridge package yesterday.
Okay. Given that Congress took so long to get to this package, and you have called on Congress to provide additional aid, how hopeful are you that there will be some kind of follow-up package under the new administration?
Well, Peter, I'm always a glasses half full person. I'm hopeful and optimistic. In my conversations with the Biden-Harris administration this week and last week, what is really, really clear is that the president-elect and his vice president-elect, Kamala Harris, are absolutely committed to getting additional resources. In this second package that was passed this week, what you'll see is missing is direct aid to states, local governments, and the tribes. And I think it's critically important, given that the states have been on the front line of this pandemic, given that we frankly have to balance our budgets, given that our revenues are down, and given that we are literally the safety net for Oregon families across the state, that the feds step up and provide additional assistance to the states. I know that President-elect Biden is absolutely committed to doing everything in his power to make that happen. He also understands that our schools need additional resources if we're going to be successful as we work hard to get our kids back into the classroom. He understands that our teachers, our educators need support personnel to meet the social and emotional needs of our students. And so they're going to work hard. I think it is a tough row to hoe, but I know we will have an administration sworn in January 20th that will do everything in their power to help the American people, to help the states, and to help our communities across the country.
Thank you.
Thanks, Peter. We'll go next to Drew Reeves with KPTV. Go ahead, Drew.
Hi there. My question is for Director Allen. I'm wondering if you can go back over the Moderna vaccine, just kind of go back over exactly when Oregon is going to get it and how much.
Director Allen, do you want to take that one?
Yeah, I was just fumbling with my mute button, and let me roll back into my talking points. I'm sorry, you said the Moderna vaccine?
Yes.
So yesterday we received 12,100 doses of Moderna. This week we expect in total to receive 72,100 doses of Moderna. So that would be included, the 12,100 would be included in that. The 72,100 is how much we expect to receive for the week. Next week, we expect to receive 25,000 doses of Moderna for a grand total of 97,100 doses for the month of December. We'll learn next Tuesday how much we will be able to order for the following week.
Thank you, Director Allen. Thank you, Drew. We'll go next to Claire Withacombe with the Statesman Journal. Go ahead, Claire.
Good morning, and thank you for the time. I wondered if, given the change in the number of vaccines being distributed, you might be able to give us a sense of, at what point will every Oregonian who wishes to have the vaccine, will they have the opportunity to get it? Could you give us kind of a rough idea of that?
Claire, I think the short answer is we honestly don't know. The numbers that the federal government is giving us are changing on a regular basis. You might recall that last week our allocation was down 40%. That was based on numbers from General Perna, who's overseeing these operations. What he didn't understand is that was based on pre-clearance vaccination numbers. And he was unaware that at the time that our vaccines had to go through a quality control process. So moving forward, we're obviously committed at the state level to providing you with the most accurate update information that we have. But again, as Director Allen has said, and I will say, these numbers keep changing. The numbers that the federal government keep providing us keep changing. My commitment to Oregonians is to make sure that we are vaccinating as many Oregonians as quickly and as efficiently as possible. Fortunately, we have a very robust and effective vaccine distribution system that we are building upon in order to deliver these vaccines to Oregonians across the state. It's going to take roughly about 2/3, 75% of the population to be vaccinated before we have community immunity. So in the meantime, we're obviously asking Oregonians to continue to comply with these safety measures to protect themselves, to protect their neighbors, and to protect vulnerable Oregonians. Director Allen, do you want to add anything to that?
Yeah, if I could just real quickly, Claire, one of the biggest unknowns is we don't have any visibility into whether what we're receiving now is a stockpile that was built up over time in production, or is it a regular amount of production that's coming out week by week? Presumably, at some point, what we're going to be getting is some share of what gets made each week. And so one of the fears is, did they kind of clear out the warehouse and now it's going to be a much smaller amount going forward? And so until we start seeing those January allocations, there are lots of questions like that we just don't know the answer to.
Thanks, Claire. We'll go next to Les Seitz with the Malheur Enterprise. Go ahead, Les.
Good afternoon, Governor. You mentioned vaccinations for teachers and school staff. How will that factor into a decision that you make to return kids to more full in-person classes? Is that going to be a new requirement?
Look, I am absolutely committed to getting our students back into the classrooms for in-person education. We know that many of our kids, particularly the little ones, are struggling to learn through comprehensive distance learning. And so we're working hard to make sure that our school districts have the tools that they need to get students back into the classroom. And that looks like specifically resources, dollars. That was one of the reasons why I called the legislature in a special session. I believe very strongly that our schools need additional resources to make sure they have the tools they need to keep their personnel and their students safe. We're working hard on expanding testing and contact tracing capabilities for our schools across the state. And we want to make sure that our districts have the resources that they need and the tools they need to begin. In terms of vaccinations, I have asked the Oregon Health Authority to prioritize our school personnel, our child care providers, and our early education providers in the next tranche of vaccines. They would be at the top of the list in 1B. I am doing this because I think it's critical that our teachers, our educators, our school personnel, whether it's folks working in the lunchrooms or doing the transportation, be protected, and that we are doing this while we are working to get our kids back into the classroom.
Well, Governor, if I may follow up on that, more specifically, are you going to make it a requirement that the most of the teachers in any school be vaccinated before you would allow a return to full in-person classes, whether it's elementary school or high school?
No, these vaccines are voluntary. I know that we want to encourage as many Oregonians to take the vaccine as possible, and certainly we'll be working with educators and child care providers to encourage them to take the vaccine. These are voluntary.
Thank you, Governor.
Thanks, Les. We have time for just a few more questions, so we'll go next to Aaron Ross with OPB. Go ahead, Aaron.
Hi there. I wanted to just do some quick fact checking on the phase 1B. So it will be, you're asking them to prioritize teachers as frontline healthcare, or as frontline workers, correct?
Yes, I consider our educators, our school personnel, our child care providers, and our early learning educators as critical personnel for Oregon.
And I think I misheard you because it sounded for a second like you said children as well, and I don't think that is the case, correct?
No.
Okay.
In terms of the vaccines, and Director Allen can help me out here, but neither Pfizer nor Moderna vaccines were tested on children under the age of 16. I believe that Pfizer was not tested on children under 18. Director Allen?
Other way around. Pfizer is
Okay.
authorized for kids 16 and older. Moderna is, I believe, 18 and older.
Great, thanks.
And then just when you're looking at phase 1A and these congregate living centers and long-term nursing facilities, is that including people who are living in like non-congregate assisted living facilities? So like folks who are maybe in like a retirement community, are they included?
Director Allen?
I may turn to Director Banks on that last piece. It includes most congregate kinds of living environments. There are some environments that are not they're not regulated or not kind of on the radar of our systems. But I would ask Director Banks if she's more familiar with that level of detail.
Yeah, thank you. And thank you for the question. So we really wanted to look at long-term care broadly, including some of the skilled nursing facilities as we've talked about, and other congregate care sites. That also includes smaller group homes for folks who may have intellectual or developmental disabilities. And I think as we move forward in also looking at how to grapple with and implement the ACIP's recommendation of those 75 and older, that will be another element in getting to communities that are 75 and older, and in retirement communities or other places in Oregon.
So this might not be people who are like living in an assisted living facility that has like separate entrances and stuff like that.
I think there'll be both in 1A and 1B. So in our 1A element, there we're working with the pharmacy partnership with long-term care facilities, and that includes a range of facilities. And then I think there are others who may fall outside of that, as you've mentioned, that would be considered in 1B as a way to operationally implement the vaccine for those 75 and older.
Thank you.
Thanks, Erin. We have time for just 2 more questions. We're going to go next to Genevieve Rium with K2. Go ahead, Genevieve.
Hi, Governor Brown and Rachel Banks and Pat Allen. Thanks for taking our questions today. I have a few questions specifically related to hospitals and distribution there. So let's start with rural hospitals. With this limited doses over the next couple of months, will larger hospitals be getting the priority over smaller hospitals?
Look, we're absolutely committed to making sure that vaccines are distributed equitably throughout Oregon. One of the advantages of the Moderna vaccine is it doesn't need the super cold storage. So that makes it more readily accessible to our rural communities. Director Allen, do you want to fill in?
Yeah, the Moderna vaccine is being distributed to a much wider array of hospitals around the state, and I believe every hospital in Oregon this week will have received an allocation of one vaccine or the other as part of that distribution.
Could I ask just a follow-up question to that?
Of course, of course.
Okay, so we know there are many, many hospital systems in the state of Oregon. How are you prioritizing which hospitals are getting these first rounds of the vaccine? Last week, we saw the state's largest hospital system, Providence, was one of the last hospitals to get this vaccine. So how is that working out? What are you guys prioritizing first?
They're all prioritized in first place. Every hospital in Oregon this week has vaccine.
Okay, so can you explain why last week Providence was one of the last hospitals to get it?
I don't know that that's accurate. I think they were not one of the 5 hospitals that received the initial distribution of pre-positioning vaccine that went to the super cold storage facilities. They were part of the next round last week, and so they weren't one of the first 5. But I don't think that means they were one of the last.
Okay, looking forward into the coming weeks when you get more of the vaccine, will you have the state's largest hospitals prioritized first?
The prioritization for hospitals will be based on the demand and the ability they have to be able to effectively and efficiently vaccinate. So I would not say we're trying to prioritize based on the size of the hospital system. I think we want to get the vaccine out as effectively and efficiently as we can.
Thank you.
Thanks, Genevieve. We have time for just one more question, so we'll go to Dick Hughes. Go ahead, Dick.
Thank you very much. And I'll try to sneak in 2 related questions. And first, Governor, when we talked to Senate President Courtney last night, I asked him what we should ask you, and he said we should ask you how you want the $600 million spent by the e-board. What your priorities are for that, and whether you think the legislature or the e-board will concur.
Well, thank you, Dick, for that question. So what has made, we had a prioritization of how those resources would be spent, but that's changed a little bit with the federal package. But here's what I would say has got to be a priority. Number one, some of those resources must be dedicated to our recovery and response efforts to the historic wildfires that we had this year in Oregon. In addition, some of those resources need to go into preparedness, making sure that our landscapes are healthier, putting literally more boots on the ground and equipment on the ground so that we can be more prepared for the challenging types of wildfires that we are seeing in Oregon these last several years. So that's certainly a top priority of mine. Secondly, continuing to make sure that agencies like the Oregon Health Authority have the resources they need to have a equitable response to the pandemic, making sure that we can continue to bring in community-based organizations and partner with them as we are working hard to get the vaccine distributed throughout the state, and making sure that our healthcare systems have the tools and resources that they need. Lastly, it's making sure that our vulnerable Oregonians have the resources they need to stay in their rental home or their apartment. It is absolutely winter. We had a torrential downpour the last couple of days. No one should be turned out of their home or their rental apartment during a pandemic. And I'm absolutely committed to making sure that we are working with the legislature and with our community action agencies across the state to make sure that we can keep people sheltered and housed during the winter and during a pandemic. And then, of course, our businesses. Our businesses are hurting. They have made tremendous sacrifices, particularly, for example, in the hospitality industry, our restaurants and bars. We want to make sure that those businesses that are complying with safety protocol and safety measures have some resources to help carry them through these next couple of months. So we'll be working with the legislature to make sure these resources, these taxpayer dollars, go where they're needed the most.
Governor, if I may just ask somebody to clarify your last point. When decisions are made about businesses, is there like a matrix that says these types of businesses contribute X amount of probability to spread of the coronavirus? I'm not, some Oregonians don't understand why businesses are closed or not, or is it just that everything needs to be closed as much as possible to spread, to stop the spread? I hope that question makes sense.
So, Dick, it's sort of two parts in there, and I'll answer the first part, and that is, why are certain businesses closed? We have roughly 29 counties in extreme risk. The good news is, if Oregonians keep up compliance with safety protocol, we're hoping to see more counties move into a lesser risk level, which means that they'll see their bars and restaurants open. I totally lost my train of thought. The harsh reality is that the businesses that are closed in extreme risk are those businesses that are most likely to spread the virus. For example, when I go to a restaurant with family or friends and take off my mask to eat and continue to talk without my mask on, it's those types of activities that are higher risk. Same with being in a gymnasium. In a gymnasium, in a gym, a recreational facility, the goal is to get your heart rate up and to breathe hard. That is more likely to transmit the virus than other types of activities. So we are continuing to use science and data to make these decisions, and I am absolutely committed to using science and data moving forward in terms of our decision making. My hope is that because Oregonians have done, frankly, such an extraordinary job complying with safety protocol, that over time we will continue to be able to move our counties into lesser risk and open more businesses. In terms of resources, at the state level, we've invested over $200 million in helping our businesses. Our focus is obviously around those businesses most impacted by the pandemic, our smaller businesses, our moms and pops. We've provided resources for personal protective equipment. We've provided resources for broadband. We invested in our hospitals, and we've invested in our historically underserved businesses. I am hoping to work with the legislature in terms of how we send additional resources out. I will just tell you at the beginning of the month, we sent out over $50 million that was distributed to the counties on a per capita basis. And the counties made the decision of how to distribute that to their local businesses. So that decision was made by the counties. In terms of the Paycheck Protection Program, I don't know what the new criteria is that Congress put in that particular program. What we do know is that it tended to be our larger, well financially connected businesses that were able to receive the vast bulk of those dollars. My sense is in reading about this new allocation is that Congress rightly has taken an approach to ensure that our smaller businesses and our businesses run by people of color, our rural businesses, our businesses that are connected to our tribes will be directed resources as well. One of the challenges is, as you know, is that many of our businesses run by people of color and historically underserved communities have been underbanked or not banked at all. And so because those dollars, the PPP went through financial institutions, whether it was banks or credit unions, for those businesses that don't have a relationship with a bank or a credit union, it was particularly challenging. So we're doing everything we can to get the money out the door as quickly as possible to those businesses that need it the most. I am, again, incredibly grateful to our businesses across the state that are doing an extraordinary job and making tremendous sacrifices to comply with safety protocol and safety measures to keep Oregonians safe. I am very, very grateful. And I know that these businesses, both large and small, are truly the heart and soul of Oregon's economy. With that, we're going to close it out for the day. Thank you all very much for joining us. Look forward to seeing you at the beginning of the new year. Please, in the meantime, stay safe and enjoy your holidays.